Hello everyone, in this video we are going to see about cardiac transplantation. Introduction. The world's first heart transplantation was performed by Christian Barnard on December 3, 1967. Cardiac transplantation is a surgical procedure performed on patients with end-stage heart failure and severe coronary disease. The most common procedure is to take a working heart from a recently deceased organ donor and implant it to the patient. The two surgical procedures used during heart transplantation are orthotopic and heterotopic implantation. Indication or criteria for selection of patients. Patient with terminal heart diseases if the age is less than 65 years, pulmonary vascular resistance, lack of active infection, recent pulmonary infection, type 2 diabetes, financial resources available. Contraindication in absolute active malignancy in last 5 years, other significant irreversible organ system dysfunction, human immunodeficiency virus positive, massive pulmonary myxoma, chronic colonization with pan-resistant microorganisms, severe pulmonary hypertension, weight greater than 130% or less than 70% of ideal body weight, social or behavioral problems, inadequate social support. In relative, the contraindications are previous surgery, chronic ventilator dependence, chronic high-dose steroids, symptomatic osteoporosis. Donor selection. Once a patient meets the criteria, the goal of evaluation process is to identify patients who would benefit from a new heart. The donor must be declared brain dead. Consent of organ donation is given by the next kind of brain dead patient. The maximal age of a male donor should be less than 40 years and a female less than 45 years. ABO blood group of the donor and the recipient must be compatible. A donor-specific lymphocyte cross-match is recommended prior to the transplantation. No heart injury or suspected injury to the heart. Apparently, normal heart auscultation and chest X-ray. In case doubt, an echocardiography is recommended. The donor body weight is ideally should be 30% more than the recipient. Management of cardiac donor. Maintain the systolic pressure at least greater than 90 mmHg because of massive diuresis. Crystalloid fluid must be infused at the rate about 100 to 200 ml per hour. Administration of dopamine. X-ray must be normal. Obtain cytomegalovirus blood cross matching with the recipient. Person of donor. A brain death certificate must have 3 signatures which belong to the donor's doctor, neurologist, neurosurgeon and the head of the department. Make sure that the donor relatives do not suffer from delay. Blood cross matching with the recipient also very important. Cardiac transplantation surgical procedures involves in two ways. One is orthotopic transplantation, the other one is heterotopic transplantation. Orthotropic heart transplantation. This procedure has been done in two methods. Method 1. This procedure begins with the surgeons performing a median sternotomy to expose the mediastinum. The pericardium is opened, the great vessels are dissected and the patient is attached to cardiopulmonary bypass. The failing heart is removed by transecting the great vessels and a portion of the left atrium containing the pulmonary veins is left in place. The donor heart is trimmed to fit onto the patient's remaining the left atrium and the great vessels are sutured in place. The now heart is restarted. The patient is weaned from cardiopulmonary bypass and the chest cavity is closed. Method 2. Total orthotropic heart transplantation proceeds after total excision of the recipient heart, leaving only a very small amount of native atrial tissue surrounding the pulmonary vein insertion sites of left atrial. Cups on the native pulmonary veins must be anastomosed directly to the donor heart, requiring 4 pulmonary vein anastomosis. Heterotopic transplantation. In the heterotopic procedure, the patient's own heart is not removed before implanting the donor heart. The new heart is positioned so that the chambers and blood vessels of both hearts can be connected to form what is effectively a double heart. The procedures can give the patient's original heart chance to recover, and if the donor's heart happen to fail, example through rejection, it may be removed, allowing the patient's original heart to start working again. Heterotropic procedures are used in cases where the donor heart is not strong enough to function by itself, due to either the patient's body being considerably larger than the donor having a weak heart, or the patient suffering from the pulmonary hypertension. Procurement. Multiple organ procurement for heart, liver, kidney incision is made from the upper part of the sternum to the symphysis pubis. Dissecting for organ isolation is begun by the liver team, kidney team and the heart team. On removal, the heart team is removed first, then liver team and then kidney team respectively. Immunosuppression. Immunosuppressive therapy with cyclosporin, azathioprine and prednisolone. Currently, it is usually corticosteroids for maintenance immunosuppressant. Another immunosuppressant is OKT3, a monoclonal antibody specifically designed to react with T cells. Heart transplantation team. In this team, we have cardiac surgeon, anesthesiologist, perfusionist, cardiologist, and nurses. Heart transplant candidate evaluation procedures. It involves electrocardiogram, echocardiogram, cardiopulmonary stress testing, peripheral Doppler, cardio ultrasonogram, tuberculosis skin testing with energy testing if prescribed steroids, differential quantitative ventilation and perfusion scan. Laboratory test includes complete blood test, prothrombin time, partial thromboplastin time, mammogram, basic metabolic panel liver function test, lipid profiles, 24-hour urine for creatinine clearance, blood typing and antibody testing, human leukocyte antigen tissue typing, panel of reactive antibody testing, antibody serologies like cytomegalovirus, Epstein-Barr virus, human immunovirus, herpes simplex virus, varicella zoster virus, mumps, measles and rubella virus. Screening for hepatitis B, hepatitis C, toxoplasmosis. Sputum for culture and sensitivity. Consultation. Patient must be consulted with transplant cardiologist, pulmonologist, transplant surgeon, physical and occupational therapist, dietitian, social worker, transplant psychologist, transplant nurse coordinator, financial or insurance advisor, dental examination and clearance. Disease prevention screening. Patient must be screened with pelvic exam with pap smear test, prostate specific antigen if older than 50 years of age, digital rectal examination if older than 50 years of age, bone density scan, colonoscopy, sigmoidoscopy if older than 50 years of age. Causes and complications after heart transplantation. Hemorrhage, additions from previous cardiac surgery, anticoagulation from cardiopulmonary bypass, infections, sternal wound invasive lines or drains, early graft failure, conditions like pericardial tamponade, poor myocardial preservation, donor-recipient mismatch, hypertension related to increased afterload, disturbances of cardiac rhythm, conditions like surgical trauma during implantation, loss of direct neural control, electrolyte imbalance, preoperative use of amiodarone. Right ventricular failure, hypoxemia, acute hypercapnia, pulmonary embolism conditions. Renal failure, ischemia during cardiopulmonary bypass, nephrotoxic medication, pre-existing insufficiency. Gastrointestinal disturbances, pancreatitis, shock liver, bowel ischemia or infection because of the cardiopulmonary bypass.